Head to toe assessment, action. Scan around the room. There's our patient. There's my work table, bedroom, and I'm using this to prop up my camera. Okay, hi, my name is Jessica. I'm going to be doing your head to toe assessment today. Washing my hands, hand sanitizer, we're all clean. Overall, our head is normocephalic. I'm looking at our skin. I don't see any lesions. I don't see any nevi on the head, the hair distribution, slightly receding, soft texture, no infestations, no masses, no indentations. Look straight at me. I'm going to palpate our temporal arteries. Tell me if you have any tenderness.
No.
And I want you to clench your jaw here. Our cranial nerve 5 or masseter muscle is sensory or motor portion is intact. Can you open and close for me? Okay. No subluxation or crepitus of our TMJ joint. Going to go ahead and palpate our lymph nodes. We have preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular. No masses there. Okay, overall, looking at our facial features, we are symmetrical. I want you to close your eyes and point to where you feel this. Okay, you can open your eyes. The sensory portion of cranial nerve 5 is intact. I want you to smile for me, frown, pucker your lips, puff your cheeks, and raise your eyebrows. Cranial nerve 7 facial nerve is intact. We're going to go ahead and move to our ears. We are looking at our outer pinna. We have some cauliflower ear right here, but no masses, no lesions, no nevi, no tenderness of our tragus either. I'm going to go ahead and take a look at our tympanic membrane. Okay, no cerumen impaction. And I can see our tympanic membrane, pearly gray, cone of light is at 7 o'clock. Go ahead and look at this side. Tympanic membrane is pearly gray. No erythema of our external auditory canal, no cerumen impaction there either. The external ear on this side looks better. No cauliflower ear over here. Pinna and tragus are without any masses, lesions, or nevi. We're going to test your hearing now. Tell me what word I'm saying.
Monkey. Apple.
Very good. We're going to do our test for lateralization. Tell me if you hear this more on one side than the other. Okay. And tell me when you no longer feel the vibration.
Yeah.
Do you still hear it?
Yes.
Tell me when you no longer.
Yes.
Okay, so air conduction is greater than bone conduction on both sides. Okay. We're going to move on to our nose. I want you to occlude one nostril and sniff. And the other side. Okay, nose is patent, symmetrical, midline. Tell me if you have any tenderness of our maxillary sinus, any tenderness of our frontal sinus.
No.
Okay, very good. Let's look at our eyes. So I'm going to test your vision, cranial nerve 2, with our Snellen chart. With your glasses on, cover up one eye, and we're about 14 inches away. Can you read this line for me?
EPTZO.
And switch eyes. Read it backwards.
OZTPE.
Okay, very good. 20/20 vision with our glasses on. Go ahead and take them off for me. We're going to check our cranial nerve 3. We are looking for our pupillary constriction, both direct and consensual on both sides. Look at the door and then look at my pen. Okay, we have accommodation and keep following my pen. Convergence, that's our cranial nerve 3. You okay?
Mm-hmm.
Okay. Now I want you to keep your eyes on my pen. Don't move your head, but follow with your eyes. We're looking at our extraocular movements. They are in tandem. No nystagmus, so that's Cranial nerves 3, 4, and 6 are intact. We're going to turn off our lights, which is hard to do with sunlight. We're checking for our red reflex and our internal eye structures. So just look straight ahead for me, okay? Okay, red reflex on that side. And this side as well. Great, thank you. Now we're going to move on and look in our mouth. Looking at our lips, they are moist, no cracking, no fissures, anything like that. Go ahead and open up. Stick your tongue out. Say ah. Okay, soft palate and uvula rise with phonation. So our cranial nerves 9 and 10 are intact. No fasciculation of our tongue in its midline. That's cranial nerve 12. Dentition is in good repair. Buccal mucosa is nice and pink, moist. No cobblestoning of our tonsils. I'd give them a +2 grade. Lift up your tongue for me. Base of the tongue, no masses, no lesions. Everything looks good with the floor of the mouth as well. And our bottom teeth are in good repair. Okay, thank you. We are going to take a look at our neck. Here, trachea is midline. I want you to swallow for me. Okay. Our thyroid feels even on both sides. No masses or anything there. Let's palpate our carotid artery on this side. Good, like +3 and +3 on this side as well. I'm going to listen for a carotid bruit. No bruit. No bruit there. Okay, I want you to shrug your shoulders. Okay, cranial nerve 11 accessory is intact. We're going to go ahead and I'm looking at our shoulder joints. They are even. There's no swelling, no deformities. The skin is intact. Go ahead and press against me with your shoulders and pull back. That's our shoulder girdle strength is 5 of 5. Let's go ahead and test our motion. Cross for me and out, extend and rotate the other way. Okay, very good, thank you. We're going to go ahead and look at our respiratory status. So I'm going to look at your back, have you turn. I'm looking at our skin, no cyanosis, no signs of respiratory distress. We've got a few nevi, but otherwise I don't see anything suspicious going on here. I want you to take a deep breath for me. Chest expansion is symmetrical. Say 99.
99.
One more time.
99.
Okay, tactile firmitus is even. I'm going to go ahead and percuss. I'm going to auscultate. Just take a breath each time you feel me. Okay, and I want you to whisper 99. And say E.
E. E. E. E.
Okay, so no whisper, pectoriloquy, bronchophony, or egophony. And turn it around to the front. Great. Again, we're looking at any signs of respiratory distress, no nasal flaring, no tripod positioning, no cyanosis, no retractions. Just take a deep breath for me. Chest expansion is symmetrical. Good. And say 99.
99. 99.
Okay. And auscultate on the front. Just take a breath. Now we're going to listen to our heart sounds. Aortic. Have you turn just a little bit. Pulmonic. Herb's point. Tricuspid. Mitral. And with the bell, aortic, pulmonic, tricuspid, Herb's point, tricuspid, mitral. I'm going to palpate our PMI. And I'm going to auscultate a full minute. And we do have S1 and S2. I don't hear any thrills. I'm going to have you lay down, and I'm going to repeat our CV exam while you're laying down. Aortic, pulmonic, Herb's point, tricuspid, mitral, with the bell, aortic, pulmonic, Herb's point, tricuspid, mitral. Do not see any lifts or heaves. I'm going to have you sit up at 45 degrees and look sideways. I don't have any jugular vein pulsation or distension. Go ahead and lay back down for me. Thank you. I'm going to look at our abdomen overall, sort of round. A few nevi, no scars, no masses that I can see. We're going to auscultate our aortic artery, renal arteries, iliac, and femoral. Okay, I'm going to auscultate our abdomen. Vowel sounds are normoactive in all four quadrants. I'm going to percuss. Timpani, 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 dullness. I'm going to palpate your abdomen. I want you to let me know if you have any tenderness.
No. 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 No.
Okay. No masses, no lesions, anything like that. He didn't have any grimace, so I don't suspect any tenderness there. I'm going to palpate for our liver. Okay, no hepatomegaly here. And palpate for our spleen, which is non-palpable as we would expect. I'm going to have you go ahead and sit up for me. And face your back this way again. We are checking for our CVA tenderness. Do you have any?
No.
Okay, great. And back towards me. Looking at our upper extremities. Skin looks warm, dry. I'm going to look at our hands. I want you to close your eyes and point to where you feel this. Okay, upper extremity sensation is intact. And tell me if you feel this vibration.
Yes. Yes.
Vibratory senses intact. Upper extremities as well. I am going to, while you can open your eyes now. Looking at our fingers, our capillary refill is less than 3 seconds. Grab my hands. Grip strength is 5 of 5. No swelling, no crepitus of our finger joints. Everything looks good there. I want you to flex, extend, hyperextend, and thumb opposition. Good. And we're going to flex our wrists and extend, hyperextend, rotate, radial deviate, ulnar deviate. Great. And our wrist joints look good. No swelling, no redness, no masses. They look symmetrical. Elbow joints also look symmetrical. Can you bend for me? and flex and pull up against me and pull down. And we have 5 of 5 strength in our elbows as well. I'm going to check our radial pulses here. That feels good. Okay, I'm going to put something in each of your hand. I want you to tell me what it is. So close your eyes. Okay.
Popsicle stick.
Yes.
Nickel.
Very good. Okay, stereognosis and graphesthesia. We are going to check that now. So close your eyes. Let me see your palms. Tell me what letter this is.
A. O.
Okay, that is intact as well. Now I want to do some rapid alternating movement. So open your eyes. Pat your legs like this. We are checking our cerebellar function. Okay, and I want you to touch your finger to your nose and then touch my finger and back to your nose and back to my finger, back to your nose and back to my finger. Okay, very good. And touch each finger to your thumb and back again. All right, we're going to check our reflexes. Upper extremity. Whoops, just rest your arm here. Brachioradialis. Bicep. Tricep. Patella. Let's see your leg. I'm going to do Achilles. And Babinski. Okay, that's a good one. Brachioradialis, bicep, tricep, patellar, Achilles, Babinski. Great, thank you. I'm going to go ahead and move to our legs. We're looking at, can you lift up your pants for me? Our legs overall, no swelling, no edema. Looking at our feet, toes. I'm going to have you flex and extend, hyperextend, spread them apart, internal rotate, external rotate. Our capillary refill is less than 3 seconds. I'm going to palpate dorsalis pedis, and posterior tibial pulses are about a +2. This side as well, flex, extend, hyperextend, internal rotate, external rotate, pulses, dorsalis pedis, posterior tibial, about a +2. I'm looking at our ankle joints. Can you flex your ankles and rotate? Okay, good. And our ankle joints, no redness, no swelling, no crepitus, they are even. Knee joints, no redness, no swelling, no crepitus. Press against me with your legs. Okay, good. And pull against me. Good. Our knee strength is 5 of 5. Testing our hip strength, so lift up one leg against me and the other. Okay, 5 of 5 there. Close your eyes for me. Point to where you feel this and this. Lower extremity sensation is intact. I don't see any edema. Point to where you feel this vibration. Okay. And the other one? Do you feel the vibration?
Yes.
Okay. Great. Go ahead and stand up for me. We're going to test our hip range of motion. So I want you to extend your foot and extend it behind you. I'm sorry, that was flex, extend. Good. And internal rotate, external rotate, circumduct. Okay, and the other one. Flex, extend, hyperextend, internal rotate, external rotate, circumduct. Good. Turn around for me. I'm going to look at your spine and bend forward for me. It's in straight alignment. You can come back up for me. We have a good range of motion of our spine. No deviation. I don't see any lordosis or scoliosis. Bend laterally to each side. Okay. And rotate, twisting. Okay, we have good spinal flexibility. Now I'd like you to walk a few steps that way. Looking at our gait is in tandem and back this way. Good. Now stand with your feet together and close your eyes. Romberg test. We do have a little bit of swaying, so we've got a little balance issue. Go go ahead and open your eyes for me and hop on one foot. Okay, very good. Thank you.